In this video, we're going to talk about male reproductive health, which might seem a little bit odd considering that we focus on helping kiddos with PANS and PANDAS. But the reality is that, one, there are teens who have some reproductive health concerns as part of their PANS or PANDAS. There's also a lot of adults who had PANS or PANDAS as a child that need help and have reproductive health issues. And then in addition to that, we work with a lot of parents because we recognize the reality that for the kiddos to heal, the entire family needs to heal as well. And so this video is for the older folks and potentially for people who are working with us in addition to their kids. Or maybe you're working with somebody else completely and you just happen to stumble on this and it's a useful video for you. So let's go ahead and dive in and talk about male reproductive health. So we're gonna talk a lot about erections. We need to know things about erectile dysfunction. Dr. Petersons, let's just go ahead and dive in right there. Let's talk about erections.
Yeah, so either erectile dysfunction or lack of sexual desire, or potentially spontaneous erections, like when they wouldn't, be normal, like potentially in the morning upon waking, being a normal time to have an erection, but, having uncontrolled erections or erections without desire can be really useful. And I think, with our kiddos, that's actually where we might see stuff is erections
Sure.
with rage or erections that are undesired or painful, things like that. Very useful and characteristic symptoms.
More characteristic when we're dealing with strictly PANS, a little bit less characteristic when we're dealing with PANS and somebody who's on the autism spectrum. That said, it's still a useful information to share regardless of the age. We can also look at things like premature ejaculation, spontaneous ejaculation. That can make a difference. When we're talking about children, we can talk about whether or not they're having a high level of masturbation, inappropriate masturbation. And we can also talk about, for adults too, about very, very high. So it could be very, very low or very, very high sexual desire, especially if it's to the point that it's interfering with normal daily function. We can also just talk about general sensitivity of the genitals. And so if there's like the slightest touch causing a trigger or pain even from the slightest touch or anything, that can also be a useful symptom to share.
And any symptoms that are potentially worse with intercourse, whether that's pain or itchiness or, whatever it may be tied to that. And then the other thing that we didn't really mention in the urinary section, but I think applies to the male reproductive health is just the stream of urine. Is it coming out in dribbles? Is it a really strong stream or is it super slow? Those types of symptoms can be really useful, especially with men that have, prostate health concerns.
And then, of course, the testicular symptoms as well. So if you have any testicular pain, testicular nodules, if you have pain or swelling, any of the modalities around it. So do you have pain with walking? Do you have pain with sitting down? Do you have, which side is swollen? What leads to the swelling? What gives any relief from the swelling? All of those general modalities that we talk about in the basic modalities video are useful when it comes to testicular pain as well.